As the coronavirus pandemic coincides with the 2020 US election, roughly 200,000 Americans have died of COVID-19, which is the highest in the world, and Trump made errors in combating this virus, such as downplaying it and cutting the pandemic response team. But was Trump responsible for the high coronavirus numbers due to his own incompetence, as some would assert? Well, let us analyze these claims. The first is, Trump's incompetence led to lower testing for coronavirus patients. It is true that the US had much lower tests per capita compared to other countries, especially since at one point, South Korea tested 65,000 people, while the US had only 459 tests. The lack of testing in the early critical periods of COVID-19 had exacerbated the crisis in the US. What is not common knowledge is that the tests had a faulty region, and the CDC refused to allow other businesses, universities, and labs to roll out their ready-made tests in those critical moments. It is understandable to make sure false tests are forbidden, but in an emergency like this, the CDC should have at least quickly checked the tests in the private sector and approved as many reasonable tests as possible. The next point probably made would be, Trump's so dumb, he made the US have a higher unemployment rate than other countries. Corn pop. Again, it's true that from February to April, the US unemployment rate gone from 3.5% to 14.7%, despite countries like Germany's only gone from 4.7% to 5.5%. However, there's some nuance here. The North American nation's solution to unemployment was mostly relying on unemployment benefits, which is in contrast to Germany's, where work hours are vastly reduced and the government pays most of their wages. The welfare benefit solution of Canada and America may prove to be better if the pandemic causes longer-lasting changes to the economy, so the European solution would just delay the inevitable, and the number of hours worked in the US fell by 17% versus 23% in Germany and 28% in Canada. So the employment situation is somewhat similar, but have different solutions. Okay, now what's the next claim? Alright, Trump didn't send enough masks. Not exactly. China manufactured 50% of the world's masks and respirators, so the US started to make less masks anyway. And when the pandemic hit, China had to prioritize the masks for their own country first. America also wasn't hit hard by Chinese viruses like SARS in 2002/3, unlike Southeast Asian countries such as South Korea. Keep this last fact in mind later in the video. Moreover, even left-leaning Vox had to admit the multiple previous US administrations and the rest of the world didn't prepare for this. P.S. Whether or not you like Trump, do you actually think he didn't try to get America to be less reliant on China? In addition, The Guardian reports that many countries had much harsher restrictions than the UK, such as France stating that self-certification is required to leave that includes a name and date, while India can fine you or even jail you for 6 months just for disobeying official lockdown orders. The US, a nation with a history of liberty, had a hard time enforcing its lockdown compared to other countries with histories based on order. This has led to much more anti-lockdown protests in the US. Speaking of India, while it doesn't have higher COVID deaths than the US despite having a bigger population, the highly strict lockdown measures negatively affected daily wage earners and poor migrants without savings. Testing rates were also low in India. In fact, it is so low that the US has a 6 times higher testing rate. Many other developing countries would also have very low testing rates, which would partially explain why the US has the most COVID deaths in the world. I've already talked about the disparity in heavy restrictions on civil liberties between the US and other countries and the anti-lockdown protests, but I haven't talked about why South Korea didn't have to restrict its liberties but still be successful against the pandemic. It was due to voluntary social distancing, high levels of testing, contract tracing, and developments in technology to track carriers to one of COVID-19 patients. These were all possible because South Korea has been near China, so suffered many novel coronaviruses and were easily prepared for the pandemic. This level of preparation is easily apparent in other Southeast Asian countries. And before the pandemic, whenever I got to my UK university, I saw many East Asian international students wearing masks even though this was months before the coronavirus, which indicates how ingrained this has been in their culture. Western democracies, including the US, didn't experience this, so bore the brunt of the virus. Furthermore, the US is made up of 50 different states, hence the name, and each have their own ability and resources to respond to the virus. Many of these states made their own mistakes, separate from Trump. One of these was New York. I assume you heard of the order to send COVID patients to nursing homes in New York by Andrew Cuomo. Let's compare New York to other states. Rhode Island has 1 million people, New Jersey has 8.9 million people, and New York has 19 million people. Rhode Island has 1,000 deaths, New Jersey has 16,000 deaths, and New York has 32,000 deaths, all from COVID-19. So far, it seems fine for New York, since when you do the math, the deaths are roughly the same proportion to the population for each state. However, when you look at population density, Rhode Island has 1,021 people per square mile versus New York's 413 per square mile. And New Jersey's population density was triple that of New York. Considering the virus spreads much more in denser areas, and hence more deaths, we shouldn't expect New York's death count to be as high as it is right now. This suggests a level of incompetence, most likely caused by the nursing home order. Cuomo responded to this accusation with the following: "It's because the state followed President Trump's CDC guidance. Capiche?" Is that so, Cuomo? But not according to this PolitiFact article, where the top administrator at the CMS pointed to the document and said that nursing homes should only accept patients they can care for, and the death count from nursing homes is officially 6,000, but has been most likely undercounted since it didn't count the nursing home residents who were transferred to hospitals before they died. Other states didn't use this method to count COVID deaths. The number came from a report and has been criticized for a flawed methodology and selective stats by scientists and other experts. While it can be argued that the order didn't force nursing homes to take in COVID patients if they didn't have to, it refused the homes from even testing patients in the first place. So what was the point? Though critics of the report have admitted that it is more likely the deaths in nursing homes were caused by sick workers, but it still doesn't excuse Cuomo's dishonesty and incompetence. Regardless, I talked about Cuomo because despite all of his actions, I wouldn't say Cuomo killed the 6,000. It is dishonest and malicious rhetoric. I still have a lot of info in the Cuomo case that I plan to save for another video, but I digress. It is irresponsible to claim the president killed 200,000 people, especially with everything I have just said in this video. And yes, Trump's rhetoric is also irresponsible, such as claiming if Biden were president during the pandemic, 2 million people would have died, which is absurd. A similar amount would have died under his watch too. Anyway, I would like to wish Trump a decent recovery from COVID, and if you enjoyed this video, please give a like as it really helps my video in the YouTube algorithm. Comment on what you think about the whole coronavirus situation, and maybe subscribe if you like political or economic commentary. God bless, and I'll see you later.